know that you are about to make a difficult decision regarding the care of your loved one, and assisted living may be your answer. Welcome to Comfortable Care Home, located at East 22nd Street and Prudence Road in beautiful Tucson, Arizona. This lovely 5-bed home is fully licensed for supervisory, personal, and directed levels of care. This home away from home resides in a family-oriented neighborhood with nice and cozy private and shared rooms. Step outside to our backyard patio for outdoor activities. Or come indoors to our large family room for television and entertainment. Our services include assistance in bathing, grooming, dressing, and personal hygiene. We maintain a high staff-to-resident ratio that ensures individual attention. We also provide daily housekeeping, daily laundry service, medication monitoring. Whether for yourself or a loved one, you can rely on us to provide a 24-hour available professional caregiver. 3 nourishing meals a day, healthy, great-tasting snacks, planned activities, holiday and birthday celebrations, and family-friendly visiting hours. Quality care can be yours at Comfortable Care Home. I never thought that I'd be looking for an assisted living home until Mom got sick. Suddenly, there were questions that I didn't have answers to. What facility could take the best care of Mom? What was the cost? How do I know how to find an assisted living home? Then, my mother's social worker gave me a brochure for Call RN. Call RN answered all my questions, assessed my mom's needs, and found the perfect place that Mom now calls home. Call RN is recommended by more healthcare professionals than any other agency, and I know that Mom will be happy for a long time. Call RN made a difficult decision much easier. Call RN was there when my family needed them the most. Thanks, Call RN. I would recommend Call RN for anyone looking for an assisted living home or facility. Give them a call today or go to www.callrn.com. If you had a hidden treasure buried in your backyard that could help pay for assisted living, would you go looking for it? What if we told you that almost every senior that has a life insurance policy has had that hidden treasure all along? Would we get your attention then? If your loved one owns a life insurance policy, you should know about a relatively new program that utilizes your loved one's policy to help pay for assisted living. It's called a life settlement. A life settlement can be used to pay for assisted living without breaking into your loved one's life savings as well as into other assets. Call Life Transitions today to get more information on how your loved one's life insurance policy can be utilized to pay for his or her assisted living costs. Call Life Transitions today at 480-556-1045 or look for us online at www.lifetransitionsonline.com. Now that you've placed your loved one in assisted living or a nursing home, you know firsthand the rising costs of care. You've taken care of your loved one's needs. Now it's time that you think of your long-term care needs. Investing in a long-term care policy now can provide for your needs in the future. To see how affordable your future can be, call us for more information on long-term care insurance. Tom Forsythe, Genworth Financial Products, underwritten by GE Capital Assurance. Call us toll-free or look for us online at tomforsytheltci.com. After you place your loved one in an assisted living facility or home, one of your first concerns will be how to get your loved one to the doctor's office. Although many homes will agree to transport your loved one for a fee, the last place you would want your family member to be is in a waiting room full of sick patients. Besides the long wait, the transport to the doctor's office alone may be too much of a burden on your loved one's well-being. TLC Healthcare Companies solves all of these problems. Our traveling group of top-notch physicians and nurse practitioners can see your loved one right in their room at their assisted living home or facility. Our staff will get to know your loved one and his or her individual medical needs. With TLC, you can enjoy personal visits in your home setting. No need for travel to a doctor's office. Convenience for you and your family, and communication with you and your family. TLC Healthcare takes Medicare and most other insurances. Give us a call today to make your loved one's stay much more convenient as well as healthy. Our years of experience have shown us that many clients thrive and recuperate more quickly in their own home. This is where they can remain independent while enjoying the support of family members and friends. In addition, you have the security, peace of mind, and convenience of familiar surroundings. Aristocare offers personal in-home care and companionship that enhances and promotes a dignified, healthier, and happier life. This is facilitated through the support of our qualified and nurturing caregivers and our nursing staff. Aristocare and its professional staff is there to help you every step of the way. Our in-home support services and hands-on personal approach to every case help us to develop long-term and caring relationships with our clients. This results in the formation of a special bond, creating a comfort level for the clients and for their families. Your satisfaction is our priority. Whether you need respite, live-in, or 24-hour care, Aristocare strives to offer just the right combination of services to promote your recovery and/or independence in the most economical way. Your safety is important to us. Each prospective employee undergoes a meticulous screening process, which includes city, state, and federal background checks, DMV records, professional reference verification, credit history. We look for previous experience in home care and qualities such as sensitivity and compassion in our caregivers. Finally, we ask ourselves the question, would we want this caregiver taking care of a member of our family? Our free initial home visit is performed by one of our on-staff nurses. This visit allows the client and family members to participate in establishing a personalized care plan to meet your every need. During this assessment, you have an opportunity to ask questions, establish your preferences, and get acquainted with our unique and flexible services. This allows you to tailor a program specific to your needs. Our professional nurse will gain insight as to the personality type and skills needed for establishing the best possible match between the caregiver and client. With various caregivers to choose from, we are confident that we can establish a mutual relationship built on trust, understanding, and respect. A nurse case manager will visit your home on a monthly basis to ensure your satisfaction with our services. Quality care in the comfort of your own home, that's Aristocare, putting the heart back into home health care. Welcome to Carondelet Hospice and Palliative Care. We provide comfort, support, and care to meet the physical, spiritual, and emotional needs of people living with life-limiting illnesses. Most of our patients receive care where they live, either in their home or a care facility. Patients who need more intensive pain and symptom management can stay in our home-like inpatient center. Our care is covered by Medicare and many private insurance plans. We provide nursing visits, personal care, pain and symptom management, durable medical equipment, medications and supplies, emotional and spiritual support, bereavement counseling. Carondelet Hospice and Palliative Care. Compassion, comfort, care.
The move to assisted living, hospice, or adult care facilities is often a confusing and distressing event. Arranging such a move for a family member or loved one can be difficult for both the person moving and the person making arrangements. Legal and financial concerns can complicate the move and can interfere with the ability to provide good and consistent care after placement is complete. It is important that family members have appropriate authority to assist the resident and to have the power to make decisions if the resident should lose the capacity to take care of healthcare and financial decisions for himself or herself. Good legal planning usually involves preparation and signing of a durable power of attorney, a healthcare power of attorney, and a living will. It is important to have those documents completed while the resident is competent. Once they are actually needed, it is by definition too late to sign them. It is also important to review and perhaps revise wills and any trusts to determine whether they still meet the resident's need for financial management and ultimate distribution of assets. Only a competent individual can sign a power of attorney, a will, or a trust. So if those documents have not already been signed, the move to an assisted living or care home setting is the perfect time to take care of getting documents prepared. Failure to have at least a durable power of attorney for healthcare and a financial power of attorney completed may well result in substantially larger legal and court costs later, when the resident may no longer be able to make the decision to sign documents. The law firm of Fleming and Curdy regularly prepares such documents for seniors and is familiar with the legal issues and personal changes attendant on the move to a nursing home, care home, assisted living facility, or hospice setting. Each of the typical estate planning documents serves a separate purpose. A financial power of attorney delegates the authority to handle bank and brokerage accounts, incoming monthly payments, and other finances. The power can be established so that the agent, who is also known as an attorney in fact, only has authority if the signer becomes incapacitated, or it can be written so that the agent has the power to act immediately. Forms for financial powers of attorney are widely available, and an attorney is not required for preparation and signing of the document. It may be appropriate, though, to consult one of the attorneys at Fleming & Curti to make certain that any unusual circumstances or wishes are properly addressed. The healthcare power of attorney and the living will work together to assure that a patient's wishes regarding medical care are carried out. Seniors who feel strongly about the type of care they should or should not receive at the end of life should write their wishes down, sign the document, and have it properly witnessed. Arizona Living Wills and Healthcare Powers of Attorney are available online at the Arizona Attorney General's website, but a detailed document more closely tailored to the patient's wishes might be appropriate. Lawyers at Fleming & Curti have been preparing advanced medical care directives for clients for decades and can help get healthcare documents in proper order. In addition to financial and healthcare powers of attorney, most seniors should have signed a will and, in at least some cases, a living trust to provide for management and disposition of their property. At Fleming & Curti, we can provide assistance and advice with all estate planning concerns. In addition to preparation of those documents, Fleming & Curti lawyers are also experienced at dealing with one other issue that frequently arises for residents of care homes, assisted living facilities, and nursing homes. Altex, the Arizona version of Medicaid, pays for a portion of long-term medical care for many qualified seniors in such facilities, and even some seniors in their own homes. But navigating the eligibility process is complicated, and it is easy to make mistakes. At Fleming & Curti, we provide counseling on long-term care choices and financing, and we can actually complete the Altex or Medicaid application itself. The pending move from one's home is a difficult prospect for most individuals. Good legal advice can help make the transition smoother and address those problems that do arise. At the law firm of Fleming & Curti, we focus all our efforts and experience on representing seniors and advising their family members. We're also proud of our free weekly newsletter and other online services available at www.elder-law.com.